Okay, everybody, welcome. I'm Paula Stanton. I am the clinical midwife consultant for the midwifery group practice here at the Gold Coast. And I'm really pleased to see everybody join us while we explore waterbirth and particularly for women who have had a previous caesarean section. Firstly, I'd like to acknowledge the traditional custodians, particularly the Yugonbear and the Kumbameri people, and pay respects to their elders, past, present and emerging. As there is a significant delay in the integration of scientific research into clinical practice, we really welcome the opportunity for Bethan to share her findings and from our other clinicians and consumers today with the general public and other clinicians. And I'd firstly like to welcome Sally to tell us a little bit about PBB Media. Thanks, Sally.
Thank you. My name is Sally Cusack and I'm from Pregnancy, Birth and Beyond Media. We're a community initiative of parents and professionals committed to giving airspace to the pressing and often ignored issues of arguably the biggest job in this world, and that is the bearing and raising of the next generation. We've been broadcasting a weekly radio show down in Byron Bay where we're based on our community radio station. So there's always an opportunity up here in Gold Coast to tap into your community radio station and broadcast some of this enlightening information for the wider public. Our shows are available to international audiences via podcasts, and we've launched this PBB Talks series last year, this time last year we hosted Millie Hill from the UK, who's the founder of the Positive Birth Movement. And earlier this year we had another couple of events on informed consent, particularly in relation to maternity care. And those two seminars featured Dr. Beck Jenkinson. And that was called A Close Look at Informed Consent, and that's available from our website for free if you want to listen to it. So it's great to see maternity service users here today. Can we see a show of hands of here we go. At the front here there's a couple of, other maternity users. Thank you for coming, and you're really a vital part of this picture because the research is important, but we need consumers to press for it and to ask their clinicians for the care that they want. So we're going to be recording this session today. So if you're not wanting to be recorded, perhaps just be aware of that, maybe reserve your questions for later. And this will be available for listening back next month. It should be available from our website. And today we're honoured to be collaborating again with Griffith and Gold Coast University Hospital to bring you vital information from midwife and PhD candidate Bethan Townsend, who's going to be walking us through her research into women's experiences of vaginal birth after caesarean. We'll also hear the stories of two women who are here today, Annalise Bradford and Caroline Jackson, who ventured outside the box into firstly wanting a VBAC and secondly seeking waterbirth as well. And we also have obstetrician gynaecologist Dr. Kirsten Small with us to take questions at the end. And the film that we were screening just before starting is a film by Dr. Robin Thompson of her years in practice showing lots of waterbirths. And Robin's here for you to talk to later if you would like. So please join me in welcoming Bethan Townsend.
Okay, thank you. So today I'm excited to present and discuss with you my initial research findings, which is on women's experiences of using water immersion for labour and birth in the context of having had a previous caesarean section. So I first became interested in this subject whilst working as a caseload midwife in a midwifery group practice. I found that when I supported women having a water birth, as the evidence has found that they use less pharmacological pain relief and seem to have a more positive birth experience with less intervention. In 2013, the midwifery group practice that I was working in started taking women who'd had a previous caesarean, but were low risk in every other way. As a group, we discussed ways in which we could maximise the chances of these women having a normal birth, and water immersion was one way we thought we could achieve this. So during the process of developing a guideline for the hospital to use water immersion, it was discovered that there was limited evidence around women wanting to use a VBAC and using water immersion for labour and birth. This was the start of my PhD journey. So to begin with, I'm going to give you some background information regarding the current statistics and research surrounding caesarean section rates, VBAC and water immersion. So I'm sure many of you are aware of the World Health Organization statements. In 1985, they recommended that the caesarean section rate should be no higher than 15%, as surgical birth above these figures are considered to be detrimental as they're not associated with any improvements. So surgical birth above this rate isn't associated with any improvements in neonatal and maternal morbidity and mortality. So in 2015, they released another similar statement saying that when caesarean section rates rise towards 10% across a population, the number of maternal and newborn deaths is decreased. However, when the rates go above 10%, there is no evidence that mortality rates improve. So unfortunately, globally, the caesarean section rates have continued to rise, with Australia having the 8th highest caesarean section rate in the world. This has increased from 18.5 in 1990 to 34% in 2016, which are the latest figures. This means that 1 in 3 women in Australia are now experiencing a caesarean section rate, with no evidence that this increase in rate improves their mortality or morbidity. In fact, there is increasing evidence to say that a caesarean section has negative implications for the future long-term physical and emotional health of both the woman and the baby. So from the latest available figures from the Australian Institute of Health and Welfare, they have found that currently the caesarean section rate is 34% in Australia, as I just said, that 44% of the caesareans are women having their first baby. Approximately 72% of women have an elective repeat caesarean, which is now the most common reason for an elective caesarean. Only 28% of women choose to attempt a VBAC, when it's estimated that approximately 70% of women are eligible. VBAC success rates vary, but have been found to be as high as 87% in the literature. And one of the major reasons women decide not to attempt a vaginal birth is lack of support from health professionals. So looking at what factors help a successful VBAC, the evidence has found that women have a higher chance of a VBAC if they have continuity of care by a known midwife throughout their pregnancy, labour and birth. This has been found to be as high as 87%. If they've had a previous vaginal birth prior to the caesarean, they have a 90% success rate. If the baby is in a cephalic presentation, that means head down, and very low in the pelvis at the start of labour, that is also increasing their success rate. If a woman goes into labour spontaneously and her labour and birth remain without intervention, the absence of complications of pregnancy and medical conditions, as well as having a known midwife, actual place of birth has been found to increase success as well, such as birth centres and home birth. So what are the potential benefits and harms of having a VBAC? The evidence has found that having a VBAC has less risks than having an elective repeat caesarean section. The benefits include faster recovery rate, lower maternal morbidity and mortality compared to elective caesarean. The baby's exposed to microbiomes, which is beneficial to their immunity. Immediate skin-to-skin and infant bonding, and higher maternal satisfaction. Potential complications are ones that a lot of women are told as the ultimate risk, is uterine rupture and scar dehiscence. That is quoted between 0.2% and 0.7% in the literature. However, it's unclear what the exact rate is when you really look at all the literature, but commonly 1 in 200 is used. However, also what is to be remembered about this rate is that rate is a mixture of high and low risk women. If a woman has an emergency caesarean, it also has higher complications than elective, and complications associated with vaginal birth. So what are the potential benefits and harms of having an elective repeat caesarean? Potential benefits are that it's convenient and planned. Some women find this comforting, knowing they have control. And there is a lower instance of uterine rupture and scar dehiscence of 0.04% quoted in the literature. The potential complications are that there's a higher incident of hemorrhage and need for blood transfusion, damage to the bladder or bowel. There's an increase in nursery admissions of babies due to breathing problems, and future pregnancy risks of placenta accreta, where the placenta becomes stuck to the uterus, and hysterectomy, difficulty conceiving, and obviously the complications of major abdominal surgery such as adhesions, deep vein thrombosis, infections, etc. So just of interest, some other significant research findings. Cochrane review found that there's actually no significant difference between infant mortality and morbidity rates between VBAC and elective repeat caesarean. And a retrospective cohort study in Australia, when they compared maternal and neonatal morbidity and mortality of women having a VBAC to women having their first baby, they were comparable. So I'm specifically interested in the use of water for women having a VBAC. One, because of the benefits water can give them for pain relief and keeping their birth normal, but also to find out what is important to them. The most recent Cochrane review found that the evidence that water immersion reduced the use of regional analgesia, that's epidural, found no increase in adverse events for the mother or the neonate, and women frequently describe water immersion and birth as a positive experience with high levels of satisfaction. When I looked at the research on women using water with a history of a previous caesarean section, the evidence is very limited. What I did find in the very limited research out there was that the women were motivated to use water immersion and wanted a positive birth experience. It was portrayed that the majority of women in these studies had to seek water immersion themselves, as there was little support by health professionals as the lack of belief in its safety. However, there's been no reported adverse maternal or neonatal outcomes specific to VBAC. So now I'd like to share with you some of my initial research findings. Firstly, I'd like to acknowledge all the wonderful women that have participated in my study and for all the help and support I've received from my Griffith supervisors, specifically Jenny Fenwick. So my aim of my study was to theorise women's experiences of negotiating and using water immersion in the context of having had a previous caesarean. The methodology I used was grounded theory. Grounded theory aims to better understand people's experiences and generates a new theory rather than testing a pre-existing one. I chose grounded theory because it's a new area of research. and it is particularly useful in situations where little is known and provides a framework for exploring and explaining women's experiences from their own perspective. So I recruited 25 women through 2 sources, from 2 local midwifery private practices, as they had higher numbers of women who'd had a previous caesarean and used water immersion, and from a national VBAC support Facebook page. So these are women from all over Australia. The interviews were digitally recorded and transcribed verbatim. So over the next few slides, I'm going to present my findings within the grounded theory. Throughout, I'll use some of the women's quotes, but using pseudonyms to give you examples. My analysis is still in progress, so this is just the initial findings. So this diagram is an overview of my findings. In the grounded theory, I've found that reclaiming birth was the core category. This is the heart of the problem and incorporates all the other categories. It's made up of 5 major categories, which I'll go through in more detail over the next few slides, as well as the mediating factors which impacted on the women's experiences with their underlying desire to have a natural birth. So reclaiming birth encompasses the theory that women felt so strongly about wanting to reclaim what was rightfully theirs, that they didn't want to go down the same path again, and that giving birth naturally was really important to them. When I did the interviews, it was clear to me that these women went on a mission to achieve a VBAC. And although water was my main interest, what I found was that achieving a VBAC was the most important factor, but water became a useful tool for them on their journey. These 3 quotes are examples of how the women felt overall about how they wanted to reclaim their birth, that they felt angry, didn't want it to happen again, and they really wanted to achieve a natural birth. So the first category, seeking a different path. This encompasses the woman's journey from a previous traumatic birth experience to her planning her next birth, determined not to repeat the same experience, as what I found was that they felt robbed of their previous birth. Women shared their stories of their previous birth. They frequently used words such as frightening, scary, and traumatic. Commonly, women felt bullied, abused, abandoned, and deceived by healthcare professionals, making them feel disempowered. Their choices were taken away, and they often felt coerced or dictated into decisions about their labour and birth. Donna said, "I really felt kind of bullied in terms of what I could and couldn't do. There was never any discussion. I was always told." As a result, women felt that they had been naive and unprepared, as they weren't expecting to be treated this way, nor end up with a caesarean. Their reaction to this was to gather information, knowledge, and understanding, determined for a different experience on their next birth. They also connected with other women and sought advocacy and support from a like-minded caregiver, to then go on to research and validate their options. This led on to them planning their birth to avoid the intervention that they had previously had, and reclaim their birth, their rite of passage, with an innate desire for a natural birth. The second category, water is the answer to my successful VBAC. This describes how water became their tool to help them through their labour and birth. In this category, women described how they wanted a natural drug-free birth to avoid or minimise intervention and give them a positive birth experience, and saw water as an answer to this. Women commonly described water as their best chance for a normal birth. Cassie stressed how important it was to try everything she could to have a natural birth,
and the reason why she wanted to use water. Megan saw it as a safer option to be in the bath for pain relief than on the bed with an epidural. The third category, water was my sanctuary, describes women's water birth and the water immersion experience in labour and birth. The women found water more than just a tool for pain relief and achieving a natural birth. It actually connected to them through their mind, body and soul. Water was their trusted space, made them feel in control, calm and focused. Some women even said that it improved their concentration. As their respite, they described the benefits water gave them for their body. They felt weightless, able to move around, and frequently expressed how it alleviated their pain. One woman described how the water enabled her to maintain her position of choice for hours, and commonly women were amazed at how effective it was, some even saying that it helped them advance in labour. What was most powerful about the water was how it gave women a refuge. They felt protected, uninhibited, and able to get into their own zone because of the water. Vicky described it as being in a cloud and being able to float. And frequently women described water as bliss, amazing and beautiful. Natalie, who felt like she was in her own world in the pool, visualised her support people like candle flames around her. And here you see Kate. She certainly felt like she was able to advocate for herself better when she was in the water, calling it a sacred space, and she even found that she was respected more in the pool. In the water made a difference to my birth category. Women described water as healing, life-changing and empowering. Hannah, who described her birth as healing, as soon as she'd given birth, she wanted to walk back down the corridor to her previous hospital and tell them. She'd been told after her previous caesarean that she would never be able to birth vaginally, that her pelvis was too small. Her baby was actually over 4 kilos, bigger than her first. Natalie, who'd had 2 previous caesareans, said that her water birth rewired her on a cellular level, commenting, to catch your own baby and the rightness of it, to have nobody else touch her. Actually, that was something that came through quite strongly in my research, that the women felt not just robbed of an experience, but robbed of that experience of being able to touch their baby for the first time. Some women were so overwhelmed by the experience that they described it as life-changing. One woman described it as the best day of her life, and another said that it was out of this world. When they described this experience, women commonly said that they wanted to tell everyone and shout it out to the world. The women also felt empowered, describing the experience as positive, feeling proud of their achievement. One woman said that it even improved her self-esteem in the way she looked at herself now. There was a category, however, of women who wished it had been different. This captures women who either didn't birth in the water or couldn't use water, either because of circumstances or because of hospital systems that they birthed in. What is interesting in this group of women, they still haven't given up on achieving a water birth. The women expressed their disappointment, wishing it had been different, and some about the politics surrounding women having VBACs and using water within the hospital system, as water had not been possible for them. Caris expressed her regrets for not fighting hard enough to get her water birth. Even though she ended up with a VBAC, she still thinks that her experience would have been more positive with using water. A few women used water but didn't birth in the water. They all spoke very positively about the benefits and said that they'd use it again. There were 2 main mediating factors in the grounded theory: rules for birth and my midwife made a difference. Achieving their desire for a natural birth and believing water was the answer came with challenges. particularly if they didn't have their own midwife to advocate for them. The women were constantly faced with rules. Some of these rules were so entrenched in the system that for some women water wasn't possible, or they actually decided to have a home birth. Other women who used water found water became an inconvenience for some health professionals. They frequently found reason for the women to get out of the water, such as they need to have a vaginal examination, change position, or they used excuses why they couldn't get in, such as they're not dilated enough. Hannah was faced with a notice on the door when she arrived at the hospital saying that they were not to use the birthing tub because they were short-staffed. Ironically, they said that she could have an epidural but not use the bath because they couldn't have someone to stay with her the whole time. This woman luckily had a private midwife with her, but this private midwife had only come in as a support person because she'd been admitted to the hospital as a public patient. So what she did was that she actually changed to private during her labour so that it enabled the private midwife to look after her. And then she went on to have a beautiful water birth with her midwife. Women were frequently subjected to fear-mongering tactics from health professionals with an aim to coerce them into decisions, telling them that their baby might die or drown. If they didn't comply to the rules was common. One woman who didn't want VEs in labour was told this could contribute to her baby's death, as they wouldn't know her progress. Another woman was told she couldn't have delayed full clamping, as this could cause a PPH. Negotiating their choices was challenging. Women were often made to feel that they were doing something different by choosing water. One woman commented that she got labelled as a hippie. Another who wasn't able to use the water because of protocol tried negotiating, but she said that there was too much legal stuff going on. Women that negotiated water in the antenatal period, so they went for a consultation around that 24 weeks to discuss their options and choices. They still said that during labour and birth, health professionals came into the room, into their birth space, to try and talk to them to ensure they knew the risks. Becky, who had a private midwife as her advocate, she didn't have them coming into the room, but then she felt that they were all waiting outside to pounce on her. She could feel it. The second mediating factor was my midwife made a difference to my birth. This involved women who had a continuity by a known midwife. These women had someone advocating for them. Becky commented that it's just to have someone in your corner. When it came to the challenges, they found that their midwife was resourceful, supportive, and someone they could trust. Danielle commented that she felt she was going to understand why now and be included in conversations. Their midwife was frequently seen as resourceful, especially during their consultation visits at the hospital to discuss their options. One woman said that she was pleased her midwife was there because she was able to give statistics and prepare her for the conversations. Anna said that she would have taken the doctor at face value saying she couldn't birth in the water if her midwife hadn't given her the proper information. What was apparent was that having a known midwife was an important factor to being able to use water. So to conclude and sum up my findings, overwhelmingly these women were found to be traumatised by their previous caesarean birth. Women went on a mission to reclaim their birth, driven by a strong desire to have a natural birth, feeling like they'd been robbed of a special experience. Water was more than just a tool for pain management. It encompassed their mind, body and soul, with a powerful message from the women saying that it improved their concentration, confidence and ability to feel in control of their birth. it was their trusted space, a protective barrier. Sadly, women frequently had to battle the system and negotiate the rules to achieve water immersion, and water was often seen dangerous or something to be feared by health professionals. What is it about water that scares professionals so much? Surely it's a tool to help women through labour and birth and reduce their intervention. Surely that's a good thing. It's only water at the end of the day. There are no drugs involved, there's no intervention. Having their own midwife was an important factor for women being supported to use water, as well as being their advocate in the many challenges they faced. So I just want to leave you with a couple of quotes, a few quotes from some of the women. Kate, she said that I think in most situations that water immersion would be really, really fantastic addition to VBAC labour, if that's what the mother wants. For lots of reasons, but like not just for the pain relief, but also to have that sense of control, personal space, and the ability to make decisions from a respectful distance, while not having someone with their hands inside your most private parts. This woman had a previous caesarean for post-dates induction. And here are 3 quotes from women who had water births. Ursula said that she loved that there was less possibility or need for people to feel that they needed to catch the baby, and it was much easier for the woman to do that in the pool, so it's really important to me. Georgia said, "It's been a very positive thing for me, and I don't know if you can tell, but I just talk about it all the time. I just feel excited." And Willow, she said it was amazing. It's something that I really wish every woman could have an experience like that, because it's just so empowering and so beautiful, and there was no fear. It was awesome. Thank you. Annalise is a mother of 3.
Yep.
And she had 2 previous caesareans and then went on to have a VBAC in water.
I did.
So I'll just hand this over to you to tell your story.
Thank you all for being here to listen to my very short version of what is essentially a very long story. So this is just a capture of my experience of having a drug-free water birth after 2 previous caesarean sections, which is relatively unheard of from my belief. Just a quick backstory as well. I'm also a midwife here at the hospital, so I don't want that to influence any of this, but just as a precursor. So I'm just going to start with a little bit of back history about my previous caesarean births first, before I get on to the water birth. So my first pregnancy with my eldest daughter Zana back in 2004, I was cared for in a GP shared care model of care. I had a completely low risk pregnancy, but was induced for purely going past my due date. I only needed 1 dose of the prostatin gel, the hormone gel, and then my labour started, so they didn't need to use the oxytocin drip in the first instance. So I managed to get myself to 8 centimetres dilated before requesting an epidural, which is then when my labour stalled, as it often does, and that's when they had to introduce the oxytocin infusion to try and get my contractions back, which is then when Zana went into distress on the CTG monitor. So after 16 hours of glorious labour, I ended up in an emergency caesarean section. After she was born, it was quite clear that she was actually malpositioned, so rather than being well flexed and trying to come out through here, she was an asynclitic brow presentation, so hence why she didn't want to come out in a hurry. Back in the day, unfortunately, is when we used to bath babies immediately, so she got whisked away. I didn't see her for 4 hours. I had some problems in recovery. They gave her a first bath and everything before I even got a chance to hold her. So it was obviously an unplanned, unexpected, very traumatic experience for me as a 21-year-old. I was unsuccessful at breastfeeding Zana as well, and as a baby she was pretty unsettled in general. Sorry, I'm really nervous. Don't know why I sign up to these things because I'm terrible at public speaking. So my next pregnancy with my boy Axel in 2010. Again, GP shared care model of care. Again, a relatively low risk pregnancy, other than the previous caesarean was really the only other thing I had going for me. Consultation with doctors recommended a repeat caesarean section as the safest option for me, based on the risk that my uterus would explode during my labour, and I feel that that was basically the only opinion that I got. So, of course, you know, as a young woman, you know, with no other experience, you go for, as Bethan said, face value with what the doctors tell you. No, I didn't want my uterus to explode, so I signed up for a repeat caesarean section. It was also just suggested to me that Zana's malposition may have been because I've got quite bad scoliosis as well. So it was sort of put to me that, you know, you don't just want the same thing to happen again, do you? Like, this is actually your safest option. So away we went. I was extremely traumatised again. Even though I'd had a previous caesarean, I knew what to expect. My husband was shocked at how I coped or not during the surgery itself. So even though it was planned, it was still quite an awful experience for me. Again, unsuccessful at breastfeeding and another unsettled baby, and then went on to develop quite serious postnatal depression after Axel was born as well. So, come to last year, surprise number 3, big surprise number 3. Since Axel was born, I became a midwife. So obviously I now have lots of knowledge and understanding about all of the risks associated with caesarean section and VBACs and everything listed there, as well as the benefits of a natural birth for both mother and baby, the benefits of hormones of labour even before a caesarean section birth, which was never even highlighted as a thing to me previously. Plus I still had, 13 years of viewing myself as a complete failure as a woman for not being able to birth and breastfeed my babies. So a desperate yearning to at least try for a vaginal birth this time. I had always said that if I had absolutely had to have another caesarean, I was at peace with that. But I just wanted the opportunity to at least try for something different this time around. As a midwife, yes, I have all of this information, but I believe that all of this stuff that Bethan's just explained is stuff that should be given to all women. In those consultations with doctors and midwives, you don't need a 3-year university degree to understand that stuff, but it's about actually, as a health professional, providing that information, that holistic, both sides, all the options, so that a woman can make a truly informed decision. So several consultations with the obstetricians, including one of our senior consultants. I was accepting for extra monitoring during my labour and birth, as well as extra precautions like having a cannula in. I just about fell off my chair when the senior consultant said he was happy for me to use water immersion during my labour, but that he wanted me to hop out to give birth. I didn't quite understand why, but I was just so elated that he'd said yes that I just shut my mouth. So my midwife, so I was having continuity of care through the birth centre here with a known midwife, and she was present with me during my doctor's appointments, was there as sort of my wingman, my advocate for me. A couple of other complications occurred along the way. I'm not going to sort of dwell on those too much, but my final appointment with the doctor, a different doctor this time around, after my due date, told me that he was not happy to use oxytocin to induce my labour, which was kind of needing to happen, even though that had been previously said that that would be okay. I completely understood his reasoning for not wanting to use oxytocin. As he said, he's at the other end of things, putting back together those uteruses that have exploded, essentially, is what he said to me. But I just felt like the odds were completely stacking up against me. So I found that the mixed messages from doctors was confusing. You know, one doctor said he was happy with this, another doctor said he wasn't happy with that. But, you know, and that's as a health professional myself. So as a woman, you know, I can certainly understand how confusing that must be. So essentially our plan was devised that on the day I would come in, I'd have my waters broken, and then we would wait. And if I laboured, great. If I didn't labour, I was off down the corridor to theatre for another caesarean. So I suppose that was kind of the, you know, the best I could hope for, really. So I went through lots of natural preparations at home, lots of acupuncture, lots of clary sage massages, and had my amazing support team around me. I desperately wanted my whole family to be present during my labour, my older kids included. I did a lot of meditation, a lot of positive affirmations, really trying to frame, and this is something I talk to women about all the time as well, is that the discomfort of labour is a good pain. You know, it's helping you to achieve something. It's not a bad pain like when you break your leg. Anyway, so had my waters broken at around 9 o'clock in the morning. By 10 o'clock I was having regular painful contractions, yay! I actually said to my husband, I'll feel better when it hurts. My midwife did another examination at around 11 and found I was 4 centimetres in active labour. I hopped into the bath around about 1:30, got that involuntary urge to push, surprised the heck out of me. My midwife did the right thing and requested that I hop out of the bath to birth my baby as we had previously arranged. I declined. I just could not think of anything worse than being at that point and getting out of the bath. Anyway, I'm fairly certain I saw a slight smile on her face when I said that. And my baby Milo was born into the water at 2:29. With my husband in the bath with me and my children outside watching on as well. So it was absolutely a life changer for me, you know, after 13 years of having just poor self-esteem and poor body image and seeing that scar every day and these boobs that couldn't feed my babies, and now 14 months on and she's still an absolute booby monster. And it's just been an absolutely empowering and completely life-changing experience for me. So I suppose, you know, for me it's just sort of backing up what Bethan said, you know, don't just take what you're told for face value, ask the questions, you know, get all of your options, I suppose is, you know, what I bang on about the most. So the water, I suppose, is what we're sort of more here to talk about. For me, it was everything that Bethan's found in her research. It was warm, it was comforting. I ended up labouring and birthing sort of in an all-fours position, and I found that being in the water and in the tub kept that really private and discreet. I feel if I'd been in the middle of the room or on the bed, that, you know, it's quite exposing. I sort of felt like, well, this is my space, nobody can get to me in here, so that was that, you know, there was not going to be interventions happening, you know, that was my little bubble. I was able to move around and change position easily. I got my hubby in the water in the last little bit, so he was able to provide that really close support. And being that it is a hands-off birth, exactly what Bethan found, you know, you don't have hands all up in your bits while you're trying to birth your baby, you're just able to follow your body's natural urges and instincts and just be guided by, you know, your midwife on the other side. So that's my experience of a drug-free water birth after 2 seasons.